Hello, and welcome to today's webinar on digital mapping for public good. My name is Kira Silk. I'm the director of the Grand Challenges for Social Work Initiative, and today's webinar is part of the Harness Technology for Social Good Network webinar series. This webinar is being recorded, so if you have any questions or want to refer back to any parts, you will receive a link to the recording after the webinar. If you have any questions throughout the webinar, please submit them via the question and answer function or the chat function, and we'll be monitoring that throughout the webinar. We'll try to save most questions until the end. Today's webinar features Dr. Tom Felke, who will lead us through his information, but first I will pass this webinar to Dr. Stephanie Kosner-Berzin, who will introduce us to the network.
Thank you, and welcome to our webinar, Digital Mapping for Public Good. You want to advance the slide? Wonderful. So I have the opportunity to be able to represent a group of individuals who've been working for nearly 5 years as part of the Grand Challenge effort for social work. As many of you may be familiar with, the Grand Challenges is a field-wide effort to really commit collectively over a 10-year period for us to advance the field of social work in key areas. Some of the areas focus on particular social problems, be it related to homelessness or youth development, but our challenge instead was really about how do we as a field begin to harness technology in order to achieve social aims, in order to use technology for social good. Our Grand Challenge is led by 6 faculty from across the country and focuses on areas of social work as it relates to practice, research, and teaching. You can advance. Thank you, Kira. When we started our work in this area, what became important to us was the fact that within the world, technology has dramatically shifted how people communicate, the access we have to one another, our ability to connect and access people in remote locations, access as it relates to disability, implications as it relates to poverty and equity. And we began to think about how, in fact, might this shift or enhance our ability to provide social work services practice over the coming years. Social work's been slow to get into technology due to lack of investment, some hesitance or reticence on the part of social work practitioners and faculty in order to engage more fully. As many of us in the recent months have really noted, technology is a pivotal way to maintain communication and connection, particularly in the current context. And so for us, this challenge is really about engaging with all of you, engaging with our full field in order to think about how, in fact, do we amplify more technology use within our practice field. You can advance the slide, please. Looking just real briefly at what we've done so far and some of our goals, we're looking at the ideas of how, in fact, do we expand connectivity, how are underserved households left out of the digital age if they're not, in fact, connected. We're interested in cross-sector practice and, cross-state practice, and that has really been pushed forward by recent work that's happened as relates to COVID-19. Work on telehealth is increasingly important for our field. We're interested in issues as they relate to data sharing and data mining. And then in terms of training, we've been interested in how do we attract social workers who have the skill set to train and utilize technology in practice and in data work for social good. Some of the particular areas that we focused on both in these webinars and some research we've looked at is how, in fact, does technology like mobile applications, gaming, data, and the internet infuse into our practice. Overall, what we're looking for is how do we invest in curriculum and pedagogy in order to make our field more ready for digital challenges? How do we expand access to data in order to improve our research? And how do we broadly inspire the next generation of social workers to use technology in a more meaningful way? We can advance the slide. And to that aim, one of our more recent efforts has been a series of webinars. We've had 3. We have 1 webinar coming up that will look at virtual reality training in September. So we thank you to those who've joined us before, and we look forward to future opportunities to connect through the network. Thank you so much, Kira, and thank you, Tom, for being here today to talk to us about digital mapping.
Great, thank you, Stephanie. I'm now going to pass the presenting privileges over to Tom, Dr. Felke, who will lead us through today's webinar.
Thank you, Kira. I'm going to get my screen set up here. All right, well, good afternoon, everyone. It is a pleasure to be back for the Grand Challenges webinar. I had the good fortune to present earlier this summer on using mapping specifically in that sense around the COVID-19 pandemic with some work that we've been doing here in Southwest Florida. To let you know a little bit about myself, I am an associate professor and I'm also the chair of the Department of Social Work here at Florida Gulf Coast University. We are located in Fort Myers, Florida, way down in Southwest Florida. I am also now the interim chair of the Department of Health Sciences in the Marib College of Health and Human Services here at FGCU. In terms of mapping, here's some good news for all of you. I am completely self-taught. I am not a geographic information scientist. I don't have any degrees in this area. It was really something that speaks to the title of this presentation, Digital Mapping for Public Good. I had started dabbling in geographic information systems work in my very first role as a child and family program specialist with Catholic Charities in Connecticut. I was tasked with locating sites to establish 2 school readiness programs as part of a $5 million grant that we had at the time. And as a guy from Philadelphia, I didn't know much about Connecticut. So I used the little bit that I knew about mapping to create a map of the South Connecticut area where I was working and obtained data from a lot of different sources like the Department of Health, the Department of Children and Families, the Department of Transportation, and cobbled all of that together in a geographic information system in order to create a map that showed where the gaps were for early childhood education and child care at the time in Southern Connecticut. I presented that to our board of directors, and they established 2 child care centers that still operate today in Southern Connecticut. And I'm always proud of the fact that the work that I was able to do at that point has been sustainable over time and still impacting those communities. So that's great news for all of you. You can learn this. And as I talk about in the presentation here, we are going to see more and more accessibility as data becomes more freely available and is pushed more to online internet servers, internet map servers specifically, that you will have the opportunity to use some of these things. And I'm going to show you a couple freely available tools in this session today so that you can get started and do some of your own mapping in that regard. So let's talk about what a geographic information system is. So GIS is this organized collection of things. We talk about hardware and software. Probably the most important thing is the data, because really what we're doing when we use a geographic information system is we're combining 2 sets of data. We're combining what we call attribute data that a lot of us talk about in terms of demographic data. And we are taking spatial data, which are digital versions of maps. And basically what we're doing is we're joining those 2 things through some spatial reference. That spatial reference could be a street address. It could be a city, a zip code. It could be a census tract. So the really big piece that we see here is actually that last term that you see in this definition, geographically referenced information. Think about the work that you do. What types of geographically referenced information exist in the work that you do? If you are an individual who is in case management, your clients likely have some type of geographic reference. Generally, that would be the street address of the location where they reside. Now, for some individuals, maybe individuals experiencing homelessness, they may not have that specific of a geographic reference, but you may be able to get information about the zip code area in which they generally reside, or maybe the county in which they reside. And all of this information, as long as it is geographically referenced, we can make a one-to-one match of this information in a geographic information system so that it can be displayed visually to illustrate whatever it is that we're looking at, whether it's a social issue or whether we're examining service gaps. So this is what a GIS is really designed to do. Now, GIS really has taken on a broader definition. Think about what you do in your own lives. You generally use spatial referencing tools, and you probably use them on something like this. Your cell phone has a GPS in it, a global positioning system, and that is why when you are using your smartphone to get directions to a location, one of the things it always asks you is allow access to your current location. And that's a global positioning system. And a global positioning system is a set of satellites circling the globe that uses triangulation, so 3 satellites, to pinpoint your location wherever you are on the Earth. That can then be utilized for what we call routing. And again, we tend to use our smartphones very often for this task when we're trying to get from point A to point B, whether it is in our personal or our professional lives. So those are some lower level aspects of how we use geographic information systems, or what are becoming more readily known as digital spatial technologies. Now, in some of the work that I do, I utilize this on a bit of a larger level to do things like research and policy planning and even education and advocacy outreach. What I love about this definition is the last element that it puts in. So it talks about the hardware, the software, the data, but the other piece that it brings into it is the personnel. And I love the fact that it continues to bring forward the idea that we are still a necessary process in using these technologies, because we're the ones that know what we're trying to examine. And so that has been one of my large impetus for doing this type of work and for educating students and others on how to do this work, because I think it's so important that as social workers, we have the ability to utilize these technologies on issues that we know so well, rather than having to rely on other individuals who may not know those issues so well and may not understand a lot of the small nuances that occasionally come in when we're trying to conduct research or utilize certain types of technologies. Now, geographic information systems allow us obviously to create maps, but they also allow us to capture, store, update, manipulate, analyze, and display data. The display piece is what everyone thinks about the most, but all of those other pieces are also elements that are available in the use of a geographic information system. So, where do we place geographic information systems, specifically in the profession of social work? Well, in my estimation, think of any facet of our profession, and you can find a use for GIS technologies. I don't think we're really limited in any way, shape, or form. I believe that macro, meso, or micro applications of GIS technologies are absolutely possible. As I've touched upon, a lot of the ways that I've used GIS technologies have been in the area of education, research, advocacy, policy planning, as well as other elements, other tasks, particularly in the local community here of Southwest Florida. Some of the larger projects that I've worked on around geographic information systems have mirrored some of that early project I did with Catholic Charities in Connecticut. The first project I ever did here in Southwest Florida was a mapping of the needs of older adults in Collier County, Florida, or in Collier County down here in Southwest Florida. So I mapped out the entire community and then gave a presentation of all of the results using demographic data, primarily from the Census Bureau. What was interesting was when I went to give my presentation, I had all my maps digitized up in a PowerPoint presentation in a very large room, and I started showing these things, and I had a woman come up in the middle of the presentation, stands up and says, "You don't know what you're talking about. This data is all garbage." And I was shocked. I had no idea where she was coming from with this position or how to really even address it. I had never kind of been attacked like this in a presentation of research results. And I asked her, I said, "Well, why is it that you feel that way?" And she said, "Well, this is Naples. There's no poor people in Naples." So the context was really important here. Naples, Florida, which is in Collier County, is routinely ranked as one of the top 5 cities per capita in the country in terms of millionaires. So we do have a very wide disparity in terms of socioeconomics and wealth. So for this individual, these maps were really challenging to comprehend. But what was great about it was after that was over, a lot of individuals came up to me, as this woman had also come up to me and said, "Yeah, you know what? He's right. These maps are actually accurate. I have clients that are in that gated community. I have clients that live in that country club community." Now you have to understand, again, contextually, part of what happened here was that this was right after our most recent Great Recession. So we were still recovering from this and coming out of it at the same time that I'm doing this research. So the maps ended up being a very powerful visualization for people to come to understand what was going on. As we often say, a lot of times we hear in policy, NIMBY, right? Not in my backyard. Well, these individuals were finding out this is in your backyard. And this is something that we need to address and need to start paying attention to, or else it could become a really problematic issue down the line. So that research actually led to the establishment of 2 senior centers in Collier County, one of which is about to expand into a 10,000-acre campus down here, which I am overly thrilled about, that we are doing so much good work on behalf of older adults and that I'm able to contribute in that way to these projects. So to that end, I love this quote by Jack Dangermond, who is the president and CEO of a company called Esri, which puts out the software that I use to do geographic information systems, which is called Arcgis. And Jack said at a conference, "We are only limited by our collective imaginations." And I think in social work, that could be true. Now, we're not quite there yet, but we are making strides in terms of the use of these technologies in our work. So what does social work and geographic information systems look like exactly? Well, compared to other professions, social work has been somewhat slow to embrace the use of these types of technologies. But GIS has been used widely in other professions since the 1960s. Granted, that's primarily been in the areas of land use conservation and management, but it's been around for, all these years, and we are just now starting to get into this. The first real articles that we saw utilizing GIS in the social work profession weren't produced until 1995 and 1998. So this is still a relatively new technology in our profession. The good news is we have seen a pretty sharp increase in its use. We are seeing more articles and more presentations being produced at a lot of our social work conferences. But our profession is working from behind at this point, and we really need to catch up quickly in order to take full advantage of what is available. When I started using geographic information systems, it was the advent of desktop-based GIS. And we have come so far in that amount of time, from desktop GIS to online GIS technologies, even to smartphone GIS technologies. And not just the ones that I mentioned earlier about global positioning systems and routing, but I actually use my smartphone as a data collection app for a lot of my GIS work, which I'll talk about in a bit here. The grand challenges, therefore, provide a great opportunity for the further advancement of GIS usage in the profession, which is why I was so excited to be invited to take part in these webinars. So I talked a little bit about this, but the capabilities of geographic information systems include, obviously, map creation, but also things like geocoding or pinpoint address map matching. What we can do is we can actually create a map of exactly where locations exist on the planet by using this geocoding technology so that we can create maps that show exactly where things exist in relation maybe to the populations that we are trying to serve. We can also do some spatial analysis. Now, the biggest way that we tend to do this with mapping is in terms of proximity. We do that through a process called buffering. So maybe I want to see how many things or how many people exist within a 5-mile radius to a certain point. So maybe I want to look at what is the catchment area for a social service agency. That would be an example of how we could use spatial analysis. GIS also allows us to do spatial statistics. Don't freak out. I know statistics are scary, but we can do some basic statistics like means, medians, modes, those types of things, but we can do them in a spatial manner. So in a lot of the work that I do when I'm asked to talk about or to examine where should we put something, where should we put an agency or a program within a certain geographic area, I can pick out the mean center of that geography. So maybe I'm looking at zip code areas. I can figure out what is the central zip code area out of all of the areas in a given county, for example. But I can also do higher level statistics. I can do something called spatial regression analysis. Now, a lot of us are familiar with multiple regression analysis. This is the same thing, except it adds the spatial component into the regression analysis. And one of the big areas where we've seen this used is in doing things such as hotspot analysis to find out where is the most at-risk population, for example, in terms of different social issues. We can also do data creation and manipulation, whether that is the spatial data. So if we need to redraw certain boundaries, that happened here in Southwest Florida recently when the village of Estero actually incorporated as a village, when before they were just part of the unincorporated county. So what I did was go into my map of Lee County, Florida, and I actually digitized the administrative boundary so that I could show exactly what the village of Estero was going to look like in comparison to the larger county. You can also create and manipulate your descriptive data, so your demographics. So if you want to change it, if you want to add things together to get a better understanding, you don't have to come out of the system and go back in. You can do a lot of that work directly in the geographic information system. So as I often tell my students, map creation is great, but don't just make a pretty map. Make a map that tells a story and that is going to help to affect change in the community. So what are some of the ways that we can do that? I've talked about the fact that we can very basically do some counts, percentages, and locations of individuals by using demographic data. So we can create maps that will show us where the populations are that are living below the poverty line, or households that are receiving SNAP benefits, or older adults who are living alone. That's a lot of the work that I've done recently. But we can also show resources in our community. So by using that geocoding, pinpoint address mapping, we can show where the food pantries are located in our community, or where the senior centers are located. We can also take a look at some disparities. So we can do some comparisons between our communities. This is a big part of work that I've been doing during the COVID-19 pandemic in looking at health access between communities that are known to be low income or traditionally minority communities to see what levels of health access disparities exist in those communities. And then we can also look at specific impacts, whether it is mental health, income, food security. Right now, we've been doing a lot of work, again, related to the COVID-19 pandemic, looking at unemployment benefits and SNAP benefit usage as a result of the pandemic. For example, here in Collier County, we found out that the number of SNAP households has increased by about 27% between March and April of 2020. That is a huge jump for our area, and we can map out exactly where that is happening in our local communities. So, how do we do this? What are the types of geographic information systems that exist? Well, as I mentioned, I use a very high-level version of geographic information systems, and it's a program called Arcgis. Now, some of your schools may have access to this for those who may be faculty at universities. But for those of us who are working maybe in nonprofit organizations or maybe even public organizations or for-profit organizations, you may not have access to that, that software. It is expensive. The licenses tend to be very costly. And so one of the things that I've found over time is that the training and expense of GIS technologies tend to be the biggest issues in terms of barriers to use. I can train a whole bunch of my students how to do geographic information systems mapping with ArcGIS, but then if they go out and they're working with a Catholic Charities or a Salvation Army, they're probably not going to have access to that technology, and therefore they're not going to be able to utilize their skills that they've learned, practice those things, and they're going to fade over time. So what I've started to do is look at what freely available tools are out there that individuals could use to get started or even actually do some geographic information systems mapping. And I have a list here, and I'm going to show you some of these in a minute, but there is things like the Opportunity Atlas, the US Census Bureau has mapping, the USDA has its Food Desert Atlas, one of really the forerunners in terms of mapping of social issues, obviously in this case, food insecurity and hunger. Then there are some options that move more into the commercial realm, so Social Explorer and PolicyMap. And then there's actually a full-blown GIS program that you can download for free from the internet called GRASS. And GRASS GIS actually mimics the software, the desktop software that I use in a pretty fantastic fashion. It looks really good. So there are some ethical considerations with geographic information systems, just like with anything else. So I always like to throw this in as a caution before people get started. You really do need to think about the provision of information. What are you putting out there, and how is that going to be received? Right? So if you are mapping things around vulnerable populations, for example, number one, what type of data are you using? If you're using originally collected data, we want to make sure that you have consent and that people understand that you may be doing something that's beyond a traditional research study, and you are actually going to be putting them on a map potentially. And that gets to be a serious consideration when we start using geocoding. We generally don't want to pinpoint address map individuals who may be in a vulnerable population, especially because of some political considerations. So when I worked at the Department of Social Services in Connecticut, we talked about this, and we agreed that in our department, we would not map anything lower than a zip code level. So if you think about starting at a state level, then a county level, then a zip code level, from there you would go down to something called a census tract and then a block group. And census tract and block groups, for those who live in large urban areas, we generally call those neighborhoods. But these are more administratively defined boundaries, so they may not match up exactly with what we may define as neighborhoods in our communities. But we made that consideration because at the time, the governor and the legislature really were doing a lot of things in the state to really kind of attack social services. And we wanted to make sure that we were not putting information out there that was going to be utilized to actually harm those that we were actually trying to help. So these are some of the things that you want to make sure of before you get into full-blown use of mapping of information. So to conclude this part, the use of GIS will continue to grow in social work because of the collaborations that are being made and the work being done both academically and professionally. Here in the Department of Social Work, I have a faculty member who is a social work faculty member, obviously, who's doing work in health disparities. She's doing an interdisciplinary project with a faculty member who's now also mine from the Department of Health Sciences, and they are looking at health disparities among Latino populations in an area called Immokalee, Florida. And that has been a great collaboration. And then eventually they pulled me onto that to help with the mapping of a lot of the data that they were doing. And we are doing some, I think we are doing some really great, interesting work in that regard. Now, collaborations like that, but more so between agencies and communities, would further advance the use and capability of GIS in the profession. I mentioned before the ability to collect data using your smartphone. Well, this is a great opportunity to do a community-based participatory research effort. You actually could get the app on the smartphones for people in the community and help them collect the data about the issues in their community. GIS training programs focused on the needs and efforts specifically of social service professionals need to be continually developed. There's not a lot out there. As I said, the high-level GIS software, you can get training through the organizations that produce that, but it is extraordinarily expensive. And now with the COVID pandemic hitting so many of our academic institutions and professional organizations so hard, that can be an even bigger challenge at this point. Ethical issues, as I've noted, need to be given greater consideration. Mapping is growing, but I have some concern about how that data is being produced. And so not everyone has the same type of code of ethics that we do in social work. So we need to make sure that when we see things happening like that, that we call it out. An example here that I had recently in Southwest Florida was around the COVID-19 pandemic. You've probably heard about Florida's challenges with data, but particularly around the area of mapping of COVID-19 data. And one of the big issues we had was that one of our local news channels put out a series of maps saying, these are the hot spots in the community. And it just so happened that those hot spots coincided with the known areas in the county where the most vulnerable populations resided. Now, this wasn't true. It's not that we had higher caseloads there. It was partly that all of the testing efforts were being targeted in that area and people weren't being tested otherwise, and they were only going off of the testing data. So this was a major consideration that we needed to address, and I actually contacted the news organization directly and talked about this, and thankfully they did put out a revised version of that story in their later news broadcasts. The final piece is writings about the use of GIS in practice still need to increase, and not just writings, but also presentations. As I said, I am so fortunate to have been asked to do the 2 webinars around mapping as part of the Grand Challenges, because I think it's important that we continue to push this message. There are so many ways that mapping could help organizations and professionals in the social services who are working to better their communities, whether it is through direct practice work or supporting grant and funding initiatives. That's another big piece of how I use mapping in my work, that we really just do need to keep pushing the idea of how mapping can assist social service professionals. So at this point, I want to show you some of those tools that I had talked about on that one slide. So this is Opportunity Atlas. Now, Opportunity Atlas is what we call a static mapping technology. And when you go to opportunityatlas.org, you are met with this. And when you hit Begin Exploring, it's going to show you a map with a certain type of data. So over here on the left-hand side, I can see that what I'm looking at is household income according to the map that's set out here. And this is currently organized by counties across the United States. And I can put my cursor over any one of these counties. I'll come down to where I am. See how far down I am here? So we are way down here, and I can click on a county and I can get information about these different areas. I can navigate around and come in a little bit closer to look at the geography a little bit better. And when I do, notice now I've gone to an even more discrete geography, as I mentioned before, known as census tracts. So this is more what we talk about in terms of neighborhoods. So down here, this is the area of Collier County that I referenced. And you can see that we have pockets of lower income, while at the same time we have these higher pockets of income. But this is a static mapping technology. This is really about all I can do with this map. I can, look around at some different areas, and I can look at some of the different characteristics of the neighborhoods that I select by clicking on them in the map. But that's really about it. I'm not going to be able to do any kind of analysis or proximity analysis or anything like that with this type of mapping. Another type of static mapping, but that gives us a little bit more opportunity for data, is actually the Census Bureau. You can go to data.census.gov, and this is the data portal that has replaced the American Fact Finder. And if you scroll down the home page, there's a section right in the center called Maps and Visualizations. So maybe I want to look at educational attainment in the United States. I can very easily click that link. And just like we kind of saw with the Opportunity Atlas, I'm given a map at the state level. And as I scroll in, the geography will eventually begin to change based on what characteristic I have selected on the left-hand side. So this will begin to show me a little bit different data. You can see over here, I can look at educational attainment, place of birth by educational attainment, school enrollment. And so here I can actually change my geography. So maybe I want to look at things by county. I can select that, and then I can select my data to see what's available. And you're starting to see one of the limitations. Data is not necessarily available at every geography for every marker on my left. So again, there are some limitations to this data and these resources. This is why I say they are static mapping applications. The other one I mentioned was the USDA Food Desert Atlas. This map has been around for a long time. This is also a static mapper, but you can see that it gives you a little bit of a different look. It's a little bit more dynamic in how it is viewed. And you can also select different layers. So LI and LA is low income and low access. But notice again, we have a limitation. This data hasn't been updated since 2015. So you really need to have a strong understanding of the data that you are looking at in terms of your ability to use it in a presentation. Social Explorer brings us out of the static views and brings us more into a more dynamic view. So here, again, I'm given the same type of view, but as you scroll in, it will begin to automatically change the data. Or the geography. I don't have to do that manually as what we saw on the Census Bureau website. So again, I'm looking way down here. This is Collier County where I am, and I can continue to scroll in, and this will move from, again, a county to a census tract level. I can change the data through all of these different categories, and this is what's great about sites like Social Explorer is it's aggregated data. So I can look at poverty data, but what you'll begin to notice is only some of this data is going to be available. Eventually, I'm going to hit some roadblocks, and some of this data is going to need to be paid for. So there is still some licensing involved with these data mappers, even though it does make it very easy to access this data in a spatial manner. The other one that I've used more often recently, I'm going to try and knock some of these out so I can reach it here, is PolicyMap. PolicyMap has become really kind of the foremost internet map server. You literally just hit the purple button here, and it presents very much like Social Explorer, but the ability of obtaining data at more discrete levels is very much increased. A lot of this data is freely available, but if you want to move into some analytical tools, again, you would have to pay for a license level. Now, here at FGCU, we are actually looking at purchasing an educational license for PolicyMap, because we've found just how impactful this tool could be to a lot of the work that we're doing. I mentioned before about GRASS GIS. If you really want to learn desktop geographic information systems and don't want to make a major investment, you can download a free open source copy of this. But the problem is you then have to learn it on your own. But there are manuals and tutorials available so that you can learn more about doing your own type of desktop mapping. It's a pretty straightforward geographic information system interface compared to some of the other things that I've seen out there. Now, what I use, as I mentioned, is something called Arcgis, and I've actually moved to an online version of this. And the reason I've done that is because not only does it allow me to do some of the desktop mapping that I usually do and have become familiar with over the years. So this is actually a map I've been working on recently about the needs of seniors in returning to a senior center. They are actually looking at developing a new senior center. So here is the proposed site. And I did a basic proximity analysis of 5 miles to show what the catchment area would be of older adults by zip code. So this is great because it shows us that we are capturing 2 of the highest percentage zip codes for older adults age 60 and over. The other thing that this online program allows us to do is create dashboards and web-based applications. So this is a dashboard that I created for Southwest Florida around COVID-19 information and specific resources. On the left-hand side here, I can show data from the Florida Department of Health around the COVID-19 crisis. In the center, I can provide narrative information to individuals about testing facilities locally. And then over here, I've actually created a mobile food pantry app. So this shows how we use geocoding. So with the permission of our local food bank, I went out and I geocoded the locations of all of the food pantries in the area and built a web-based app where individuals can enter their address. It will tell them the locations that are closest to them. In this case, it did it on a 10-mile radius. I can select the one that is closest to me. It will provide information about that facility. And then I can also get directions between my location that I've entered and the location of the facility I've selected. So this is some of the work that I've been doing with geographic information systems. Now, obviously, these pieces are much more high level. If I were to suggest what individuals should be focusing on in terms of getting started with this type of work, I would highly suggest looking at things like Social Explorer or PolicyMap. Social Explorer is going to give you the ability to really kind of learn how the data sets work together. And the last piece is to really do some analysis using a program like PolicyMap. Now, I have a couple other maps here, but in the interest of time, I want to get to one specifically, which is this one. So this map was a food access point mapping project that I did back in 2018 in Immokalee, Florida, as part of that health disparities project that I talked about. And I undertook this with a group of students from the University of Michigan who were on spring break. And what we did was we used a program called Survey 123. It's a very simple app in which you can set up a survey, but that survey allows you to utilize your smartphone to collect data. You can collect pictures of the locations, you can collect the geographic coordinates, and as a regular survey, you can also collect demographic or attribute information about those locations. We were then able to map all of that so that we could show all of the locations where individuals might access food in Immokalee, Florida. So as you can see, we surveyed beer, wine, and liquor stores, chain fast food sites, convenience stores, drug stores, farmers markets, etc., and put all of those together. We also put in our agency partners, so where we knew food banks were being, food pantries were located in the community. And then we also put in the public transportation routes. So the green lines and the green dots, the lines show the public transportation routes, and the dots show the public transportation bus stops. So this is a great way to engage in, as I said, some community-based participatory research as well. So I know we're running up on time, and I want to leave an opportunity for some questions. But if you have any questions, comments, concerns, or observations about the material I presented, please feel free to reach out to me directly, give me a call, drop me an email. I will be sharing this PowerPoint presentation with Kira, and if she would like to, and I'm sure she'll probably be able to share that with anyone who is interested in doing so.
Great. Thank you so much, Dr. Felke. This has been really great. There's lots of comments in the chat box about how it directly relates to the work of our attendees. So just generally really helpful information. A few sort of follow-up questions were around how you might be able to, and you spoke to this a little bit with the most recent map, around how students could potentially go into the community and locate different services using their phones to get the geocode. Is that something, you listed one app that might work? Are there other suggestions that you might recommend for this?
Sure, actually something that would work well for this. So you don't always have to use an app. There is a website, which I'm popping up right now, called batchgeo.com. And if you had your students, for example, go out into the community and collect the address data, and this is basically what it needs to look like. The street address, the city, the state, the zip code. You could put in the name of the agency, and all you really do is copy and paste that directly into this site, into this text box, hit the Map Now button, and it will actually do the geocoding for you, and you will end up with a map just like this. Right? So that could be a great way to get started with Batch Geo. You could then save this map. You could download it as an image and embed it in a PowerPoint presentation or a Word document for dissemination in that way.
Great. There's questions about some of the resources you shared, but I think we'll be able to share those through your PowerPoint after this webinar. But there was a question around whether you know of any GIS websites focused more internationally, or if there's tools or resources for folks who are in other parts of the world who are interested in doing this.
Yeah, the international piece is really hard, and a lot of that comes from the ability to share data. So I actually did my dissertation in Armenia, working with ethnic Armenian refugees. And part of what I did was map out some of the refugee communities over there. But then we realized how politicized of an issue that had become. And so we then refrained from actually creating those maps. except for the purposes of my dissertation. And even in that regard, we never actually included that into the final version of my dissertation because we never wanted that to become public in a way that it could then be politicized. So you'd probably have to look in country to access that type of information. Although I can tell you Social Explorer does have some international data sets available on their website.
Great, thank you. We have a question about kind of up-to-date data, often seeing data that is either a few years old or at least a year old. Have you come across data resources that are able to be more current, or do you have suggestions around how to account for that difference?
Yeah, I think, that's always our struggle, right? Our data is only as good as what's available. I kind of stopped doing static mapping and providing it to individuals because I know that as soon as I provide the data, it's out of date. Right now, the Census Bureau, unless you're collecting original data, the Census Bureau American Community Survey estimates are still the best estimates of data that we have in our community. So that is what I use quite often. I also collaborate, at least locally here, with our county governments. And a lot of times they are collecting data and they are willing to provide that data. Now, our two counties, primarily here, Lee County and Collier County, they also have GIS units within the county infrastructure. So that could also be a great place to get started with GIS, engage your county government to see what types of GIS resources or work they are doing.
Great. I like this question. How would you suggest going about getting GIS folks excited about bringing social work into part of their curriculum?
Yeah, so it's funny. The first time I ever did a commercial training, it was actually at the university. I was doing my graduate work, and I showed up on the first day, and everybody was introducing themselves, and they were mostly land conservation management people. And then I turned around, I'm like, "Hi, I'm Tom Felke, Department of Social Work." And the instructor actually looked at me and he said, "Why are you here?" And then I started to explain how I had used GIS on my own, and he was like, "Oh, that's interesting." And then we found out there was a sheriff in the room, and there were some other people in the room that were from like first responder agencies. And then it started to come about that, yeah, a lot of organizations are now using these. So I think the way to get people excited, if you can't tell, I get excited about this. So I think that's what it is. I think a lot of GIS people do get bored with some of the things that they're doing. So I think you need to have, like anything else, a really well thought out idea. But part of that means you need to understand the technology. So that's why I go back to, you need to have an understanding of what the capabilities are on a base level, and then approach somebody who knows this to say, "Hey, I have this idea." And a great thing to always ask people is, do you think it's possible to do that? Because GIS people love that question, because much like I said, a lot of us think that anything is possible with this data in putting it on a map and how to analyze it. So I think that's it. Come up with a white paper with a really good, strong idea of how you want to use this, and then take it to somebody and present it and see if you can get them to come on board. I think those interdisciplinary collaborations can be really powerful, but you have to have a great idea going in.
That's great, thank you. We just had a question come in around GIS in alignment with data science. Do you have any thoughts on that?
Yeah, I think there's a lot going on right now that, here at FGCU, we are actually starting a school of water where we literally are going to be looking at water quality issues because it's such a big thing here in Southwest Florida. And a lot of what we're trying to do with that is predictive analytics and utilizing big data in some of those efforts. So part of that is the GIS piece that we talked about. Some of it is the presentation of information through dashboards. Right now, Johns Hopkins University, if you want to see an example of a great example of dashboards being used in data sciences, I think look at that Johns Hopkins COVID-19 dashboard, because theirs is a full-blown dashboard a lot of different resources, much more than what I have here. Mine is much more simplified because we're trying to do something that is very public facing. Whereas the Johns Hopkins one, while it is public facing, you can access it publicly. The data is very intense and involves more, what I would say, higher levels of analysis than anything that I'm doing here with this dashboard.
Great. So there's some questions about whether this map in particular that you've worked on for Collier County and the older adults is available publicly for folks to view, and if so, maybe we can include links to those sites or maps in the email that comes out afterwards. If nobody has any other questions, we'll begin to wrap up. And I just want to thank you again, Dr. Felke, for not only doing one webinar, but doing 2 webinars for our webinar series for the Harness Technology for Social Good Network. They've really been a really great opportunity to bring in sort of the practitioner side of social work into some of the work that we've been doing in the grand challenges. And so we really thank you for that. If you haven't already signed up for our listserv and our social media platforms, those are a great way to stay in touch and stay in tune with future webinars as well as other activities we have going on through the grand challenges. You'll receive links to how to sign up and things like that with the webinar recording as well. So with that, I thank you all for joining us, and thank you, Dr. Felke, again. Take care.
Thank you, Kira. I really appreciate the opportunity, and thank you, everybody, for attending today.